Is knee replacement the only option for severe osteoarthritis? Many patients are told yes, but I am inclined to say no. Hello, I am Dr. A.K. Venkatachalam, an orthopedic surgeon in Chennai. My current interest is orthobiologic surgery. Today, I want you to meet Mr. Ramachandran, who has come here a long way and has undergone a specialized orthobiologic procedure only last week, about 96 hours before, 4 days before. So today, after 96 hours, I have reviewed him. Now I will introduce you to him and I'll ask him certain questions and let him narrate his experience. I performed the PRASAD treatment. PRASAD is an abbreviation for orthobiologic procedure. It stands for Platelet-Rich Stromal Advanced Derivate. What it means is that platelet-rich plasma, PRP, you know that. Adipose tissue is fat, and then there is an advanced derivative. So I've used also bone marrow in this combination, and then in future I will be using other fat products also. That's why it's called PRASAD. PRASAD in Indian terms is a gift from God. But here, this PRASAD is actually a gift of your own body to heal itself. You utilize this PRASAD protocol to heal the joint internally. So, sir, now I'm going to talk to this gentleman. Good morning, sir.
Good morning, doctor.
Kindly introduce yourself and narrate your condition before coming here.
I'm actually Ramachandran here. I am from Canada and I've been having this osteoarthritis problem for the last 8 to 9 years. And I've been undertaking various treatments like medications, pain medication, NSAID, steroid, starts and shots and hyaluronic acid injection and all that. But I've been always told by my orthopedic surgeons whom I have met so far that I am not yet a candidate for the knee replacement. And I was particularly not interested in the knee replacement as well. So I started to Google out.
Before coming here, what was your specific diagnosis and what activities were you unable to do?
Yeah, my specific diagnosis was that it is osteoarthritis, but the exact stage was not defined. But my difficulty mainly remained in walking for long distances, negotiating the stairs, going up and down. Up the stairs was also a bit easier, but getting down the stairs was a greater problem. And because of my living environment in Canada, which is a 3-level home, I got to execute the stairs multiple times. So I used to do that with a lot of pain.
What other treatments did you try?
Yeah, I tried, like I said, the non-steroidal painkillers, the non-steroidal pain ointments, like the diclofenac ointment, etc.
Did they work?
They worked a bit, but not to the fullest extent. But they used to give me temporary relief for that day or for that particular activity or whatever. Then I took to the steroid injections for about 2 years. They gave a 2 to 3 months relief from pain and all that. Then last year I took the hyaluronic acid injection on both the knees and with some supplemental medicines and all that. So that's been able to pull me along for this much time, but not without pain. That the pain was still there. So it was a manageable level of pain. So I was just getting along with that. And when I came to know about this particular bio-ortho treatment that the doctor is doing, I said that should be the one that I should try next, because this is definitely a stopper for the knee replacement. That's the finality.
What specific treatment did you undergo here, and how has been the experience so far in terms of the pain since the procedure? Today is 96 hours.
Yeah.
So can you name the procedure?
Yes.
From your understanding of what I have told you and what you have read before?
Yeah. From whatever I read earlier, it is only the PRP or the PRS procedures and all that.
Yeah.
But this time when I met the doctor about 2 weeks ago, he said that there is a newer treatment that is there's a combination of various other things. It is called as PRASAD, Prasad. Like he introduced that in a very nice way, because in Hinduism we know that Prasad is associated with the God. And he said this is the gift of your own body to yourself. So I felt kind of impressed by that. And the Prasads actually stands for platelet-rich adipose stromal cells diffraction.
Super, sir. You got it. How has your experience been so far in terms of pain?
So far, I will say that I had the surgery on the procedure done on the 11th of December, that's about 4 days ago. And I went home in that evening, and I would say that the only pain that I felt was because of the minor incisions that he has got to make to take the adipose tissue or take the bone marrow cells and all that. And that bandage that was kind of tightly wrapped around because to avoid any further bleeding and all that. So I was only feeling that pain. It was not the OA pain that I used to feel earlier.
Osteoarthritis pain.
The osteoarthritis type kind of pain. Because in the last 4 days, I would say that I have been fairly without pain. If at all it was there, it was because of the post-operative difficulties that are there. And I hope from today, because the bandages are all removed, I'll be able to be a new man, kind of able to walk better. And
yeah, so in terms of new man, what can you do today that you weren't able to do before?
What I'm able to do today? Well, I'm not going to try going up and down the stairs today though, but I think the walking itself, and my family folks can well say that to me. I mean, whether I'm walking in a different manner or I'm walking better and all that, but then I guess I would myself feel that difference in my walk and all that, gait, etc.
So your gait is improved.
I would say, yeah, it will.
That is, when you walk, you're not having any pain.
No, and I walk now. I just walked inside the doctor's office, kind of.
We'll show you walking outside also.
Yeah, after the bandage was removed, I would say that was without any pain.
Good. So, what is your, once again recapitulate, was the treatment good?
Yeah, I would, because I had opted for that, and for that I would say that I got the full benefit of that treatment, because that pain is not there now.
So what would you share with your near and dear ones, or anybody who is suffering from osteoarthritis, and those who are looking for this non-surgical treatments as an alternative, safe option for their condition?
Yeah. In fact, already I think there are about 2 to 3 close relatives of mine who have wanted me to share my experiences after the procedure is over about this autologous procedure, in which your body fluids are harvested. They are treated in a particular manner to make them conducive back for re-injection into your body. So there is no external medication at all. So it's just autologous. Whatever is in your body is being repurposed for rejuvenating your lost cartilage. So I would say it's a very safe treatment and a sound stopper to the knee replacement procedure. Probably that's what I think.
Now this is a political question. Do you think you could get this treatment back home in Canada?
Well, it's a very difficult question to answer. It is political, like you said right in the beginning. Yes, it is political, but the procedure in Canada is that your family doctor to whom you are affiliated is your first line of defense in terms of medication. He has got to recognize and recommend you for this procedure. And that has not happened with me in the last 3, 4, 5 years or whatever. All that he recommended me was only the steroid shots. So,
and he said you are too young for a knee replacement.
Or
your condition is not suitable.
Yeah, orthopedic surgeons said that I am not yet a candidate for knee replacement.
Okay. Thank you for coming here and having shared your experience. I'm just going to get a clip of you while walking in the corridor outside.
Yes, sir.
And then I also have to remind the viewers of your overall condition. It's not that you are right now hunky-dory and all things are done for you.
Oh, yeah, true.
Yeah, because there's a list, you have to recover your metabolic health, for which I have given you 2 pages of instructions and another 1 or 2 pages of physiotherapy and all that. And on top of that, there's another still issue to be tackled. The gentleman whom we were talking to earlier, Mr. Ramachandran, he has presented with stage 3, grade 3 arthritis. That is, there is a reduction in the joint space, and as a result of that, he has developed bow legs In medical parlance, we call it Genu Varum. So if you look at such a person, the inside of their knees normally should touch. But for him, it was like that. That is, you can see this is a C-shaped bow legs. So for that, I have recommended, ideally speaking, in an ideal world, I would have done the correction of the malalignment. That is a bow leg correction by a high tibial osteotomy and then done a biologic. But he had come on a short vacation and I suggested it to him that this is mandatory for you. He understood it. He said, my first priority is pain relief. So we have provided the pain relief as you heard. And then today I have, and previously also, I have recommended a brace to him. We have to strategize along with the patients. You see, we cannot force everything and it depends on the convenience of the patient. So I have prescribed a brace which he is going to wear diligently to minimize the load on the inner side of the knee. He will be doing that, and at the earliest, at his convenience, he will get the bony correction in the legs done one after another. That procedure is called high tibial osteotomy. So that is what I have advised. So do you agree with that, sir?
Yeah, I mean, from whatever you had explained me, doctor, and whatever I read on the internet, so the bow-leggedness and the osteoarthritis pain, they are sort of
hand in hand.
Hand in hand. They are kind of the chicken and egg story, right? Which one causes what? Bow legs may cause osteoarthritis, or osteoarthritis could lead to bow legs also. So it's the two need to be corrected, like the doctor very rightly explained. So I have to go back and think of a suitable time when I can come down and stay in India for that long to take the treatment from.
No, you don't have to stay for both the legs. You can get one done, then go and then come and have it done after some time. Just follow the physio.
Yeah. Okay. Yeah.
There's 6-week recovery period from one leg. That is, you can't put weight on that operated leg, full weight, for 6 weeks. Then that osteotomy would have healed. After that, we can do it maybe after 2 or 3 months on the other leg. So this is to generally remind, I evaluate a person the whole, including his biomechanics, his physiology. He went for a blood test, senior package that consists of 25 pages of reports. Then his bony alignment, all that, and that is where we have to be totally holistic, and then we can succeed and hope for good long-term results with this procedure. As it is with this procedure, I have patients with good results. You can see it on my website. But adding these other procedures like osteotomy and all that will help in the long run. And I hope people will one day say, so the answer to the question is, they may be one day be able to say no to knee replacement. We are making our way in that direction. And thank you for watching. Have a nice day. If you want to see more inspirational stories like these, subscribe to my YouTube channel. You know where it is. The link is given below. Have a look at my website where I answer all your questions. Like the website is also, link is given below, www.orthobiologicsurgery.India.com. There is a FAQ section for domestic as well as international patients. Have a look at that. Thanks for watching. Stay tuned. Like, share and subscribe. I'll see you in the next educational video. Thank you.
Okay, doctor.